Now we're going to move on to Indu Subaiya. She is the co-founder of Health 2.0 and the executive vice president of HIMSS, which is the Healthcare Information and Management System Society. She is a visionary healthcare leader whose work builds communities, creates dialogues, and inspires us to radically rethink how health shapes our lives. Indu is the co-founded and served as CEO of Health 2.0, the leading conference and media platform that promotes and catalyzes new technologies in healthcare. Health 2.0 was recently acquired by HIMSS, and Indu continues to head the organization as executive vice president as it scouts new technologies, advances edge, and builds initiatives to drive sustainable change in today's healthcare landscape. Indu is a female immigrant from India and is a passionate advocate for an end to healthcare disparities and increased diversity across the leadership ranks of the industry. In recent years, Indu has created a parallel career as a writer and a filmmaker. She wrote and directed a narrative short film, The Apartment, which earned the Best Actor Award at the World Indian Music Film Festival and jury recognition at the Indian World Film Festival at Bangalore Short Festivals. In 2013, Fierce Health IT named Indu one of health information technology's most influential women. Indu was born in Bangalore, India, and grew up on Long Island, New York. A physician by training, she received her BS from Cornell University in Science and Technology Studies and an MD from Stony Brook University. She came west to receive her MBA from the Haas School of Business at UC Berkeley, deciding to forego medical residency in order to develop new healthcare dialogues and care models. Please join me in welcoming Indu.
Good morning, and thank you so much for having me. I'm battling a bit of a cold, so it might sound a little funny, but I wanted to say that I'm going to be talking to you about the role of technology in the patient experience, but I couldn't agree more with what the person before me, Chrissy, said, which is it's about people. So I'm going to spend a lot of time talking about devices and gadgets and software, but the underlying message is none of that makes any difference without people. And so I really appreciated the talk before mine and hope to connect some dots to what was shared. Okay. So let me give you a little bit of an overview of what we call the digital health ecosystem, just to sort of set the stage about how we're thinking about technology at Health 2.0 and at HIMSS today. It's a huge field, and I'm sure many of you have seen component parts, but just to give a lens of kind of the big picture. So people talk a lot about the growth in this sector, and I just wanted to give you some parameters of that growth. And starting just in terms of the number of companies that have raised money to be digital health technology solutions, it's been monumental. When we started Health 2.0, it was about 10 years ago, 2007, and a few companies were starting out trying to make a difference in terms of giving patients and consumers more access to their care, to their data. That was sort of where this whole movement began. And just last year, the sector alone raised, by two different accounts, somewhere between $6 billion and $12 billion, and that's expected to grow. I mention this because of the sheer number of companies and products out there today competing for that access to sort of the clinical environment and to patient care. So we at Health 2.0 alone are tracking a little over 4,000 companies and close to 6,000 products that are in the category of digital health. These companies are from around the world, and the majority in the US, but a healthy sector coming out of Europe, Asia, Latin America, and everywhere that you can think of. This category of companies, not all of them, people think of digital health and they think, well, it means your Fitbit or your Apple Watch. But what's interesting to note is that it spans the gamut from consumer-facing health technologies to professional-facing to patient-provider communication and telehealth to data analytics and exchange. And this is how we roughly categorize the segments. Majority still in that consumer patient-facing category, but a growing number in that professional-facing and patient-provider communication. This is our segmentation. It's not the only segmentation of the sector, but we look at 19 segments of technology, and you can see how they kind of divide up. And the little yellow bars are the growth that we've seen in that sector over the last year. So from self-management tools and trackers, but all the way to clinician workflow and administrative tools. And you'll see the point that I'll be making in this talk is that the patient experience is affected by all of these components of the health experience, not just sort of the front end, so to speak, but also the back end of how we're running our healthcare delivery and our operations. So what are some of the challenges of this sort of growing, booming sector? Well, despite the number of applications and the funding, only 2% of these new technologies in digital health are connected to the underlying medical record. So what this means is that there's a gap between all the potential out there to make a difference and the connectivity within the care delivery setting and with how we administer care. So where there are gaps, there are opportunities. And the other sort of challenge is that while we're dealing with this incredible explosion of opportunity, we've got people who still want their data, people who want access to their data. This is a photograph of the walk-in gallery at Health 2.0, which is a movement of patients that are saying, give me my data. I want transparency. I want access. I want to feel empowered. And that's an artist, Regina Holiday, who's painted these jackets that people wear to sort of, say that they're with her in spirit after she went through a very, very rough experience with her husband where delays to accessing his medical record actually caused harm. So while consumers want their data, patients want their data, we want more transparency, technologically data is still siloed. And this sort of vision of silos is not where we need to go as a future in the technology ecosystem. So our vision is much more that the healthcare system, in terms of, and this should be actually moving, but if you can imagine this visual, that we'd like to think of this as a cell membrane. Ideally, all of the sort of technologies and the data streams that impact the clinical environment and impact people's health, it should be more of a semi-permeable membrane with information flowing in and out, because this is like a living system. The healthcare system needs to be continuously learning, continuously interacting with all of the parts connected, and not in terms of that vision of the silos that I mentioned. So how do we do it? When we talk about technology, we have 3 requirements for technology today to be making a difference in actual patient care and experience. Technologies have to be adaptable. They have to play well with others. They have to have a staunch focus on the user experience, and they have to use data in some way to drive a decision-making process. And if they're not doing this, they're not a digital health technology that we consider part of improving outcomes, improving the patient experience. And it is the interaction of these components of what we're calling health interface layers. It's not just a technology app on the EMR. It's not just on your phone. It's every environmental aspect of things you come into. It could be the clothes you wear. It could be a sensor in the room. These are different ways we're interacting with information and data, together with empathetic design, data loops that are gathering information about me, but also telling me something about myself that lead to that improved health experience. So one definition of health experience, and not the only one, I'm sure, as many of you are talking about this term and concept, but we've begun to think of it as there's an element of the everyday reality of what it is like to participate in our own health journeys and in the healthcare system as informed agents able to affect outcomes in a hassle-free manner. And I think these words are relevant in and of themselves, from being informed to being active, to having a hassle-free experience. And technology can play a role at all of these levels, and I'm going to be giving you some examples and then talking about how we actually measure the impact there. But just to sort of note one other construct about this ecosystem and the examples I'm about to give is that we talk a lot about empathy, as we should. It is the top of the pinnacle in Chrissy's pyramid that she presented. But it's so important to remember that the other side of the coin is empowerment. And it is very tough to think of just empathy being enough when so much of what you're seeing people need is a sense of feeling empowered, in the story given about the motivation to drive a Mustang when you get out. So we're going to talk about technology being a mediator of both empathy and empowerment and how you need both. Transparency is so important. I like to think of, how patients get through their experience. If it's an opaque wall, that's really hard. We've got to give them ladders. We've got to give them doors. They need to see their way through. They need access to information. And it's about the whole person. This is no news to anybody, but we're now getting increasing evidence that 70 to 80% of health outcomes are driven not by actual clinical points, but by social determinants of health. Okay, so 5 ways that technology can improve the patient experience. The first is this category of inform. But what do we mean by inform? Today, this means such a broad set of things, and it's so exciting because it might mean, sort of the wearable gadgets that that inform you about your health. They give you your heart rate, a whole bunch of other metrics now that are possible with all the different variables and wearables out there. But technology can also inform you at a genomic level. This is a company called Helix that's taking the genome and opening it up to consumer applications, kind of in an API format, a marketplace format. So companies and innovators and entrepreneurs with ideas of what people might seek from their genome can make their own applications on top of it. It's a radically new concept. Inform might mean I want to download my Blue Button data from the EMR, and initiatives like that I'm just hearing are now being updated to the Blue Button 2.0, a second effort by the federal government to make data really accessible. But that's not enough, because while we're getting so many new data streams and access to data around the world to patients, we need that data to be clinically relevant to care providers, and it's like a fire hose out there. So more and more companies are taking all of that information and bringing it together in an organized way into the clinical environment through intermediaries and aggregation tools. So that's really, really important. Companies like Validic, for example, will take all of that user-generated data, bring it into a clinical environment in a more cohesive and organized way. That's sort of bits and bytes, but inform can also mean the narrative journey, how patients talk about their care, and the places that we ask for that kind of interaction and make those types of interaction possible. Narrative medicine is an important element here, and technology can play a role. There are companies like Canary Health that are involved in diabetes management programs with a digital platform that are building in patient narratives into that journey, into that patient-provider communication element. And in fact, are starting to measure the outcomes of these programs where with the digital health coaching, in addition to face-to-face, they're seeing improved benefits in hemoglobin A1C, not just in the first 6 weeks after their program, but differences that persist after 12 months. So the power of narrative coming together with sort of a web-based model, together with the traditional aspects of health coaching, are making a difference in the category of inform. The second category is connect. Technology helps us connect in so many different ways, and I just want to give you some examples of all the ways we can think of what this word means across the spectrum of care. So no surprise, everybody wants to talk about what Amazon is going to do in healthcare, and Alexa, which is it's really intriguing. And we had, I'll present in the next example, kind of a competitor, Alexa, presented Health 2.0 this past year, but the idea of connection here is really interesting, right? It's not just the ability to sort of call out to Alexa, today it's about music, and turn on the lights and whatever, but we're beginning to see people be able to make doctor's appointments from their home just through voice. That was what was demoed most recently. This is Google Home. It's their version of Alexa. But what's really fascinating with new technology and new interfaces into the EMR, that they're bringing this into hospital environments where people can call out and say, where is the patient right now? Are they in the ICU? What floor are they on? Sort of for actual mobility within the hospital for healthcare workers. So if you think about connecting, it's important to think not just in one environment, but across environments, from the home to the hospital, to other care settings. It's possibly going to be one kind of technology and one kind of data framework, but different environments. So I just thought I'd bring that up. So it's, people always say, well, in the home and in the hospital, but sometimes it can be the same technology in both settings. In terms of connecting, it's so important for companies that are helping close the loop, if you will, whether that's what happens at discharge from the hospital, but even what happens between visits. Companies like HealthLoop and others are making it possible for providers to say, how did it go? How are you doing? Can you check in? Going well? Is it going worse for you at home? Do you need to come back in? Making it very, very easy to look at a panel of patients and say, these 2 people need follow-up today versus I've got to think about everybody. So those types of filters and mechanisms to keep connections going, that makes things easier. With our elderly folks, there are so many now companies trying to make a difference in connecting. This is Care Angel that allows us to call folks in the home, and even if they have a landline, sort of an old-fashioned phone, not a smartphone, to transmit the voice using voice artificial intelligence to check on them, to then have the results of whatever they answer on the phone, how are you doing today, how's it going, be translated into digital data so that we can actually help manage their care just through voice, no other interface required. Connect. Think about languages. I don't know how many of you work in centers where people come in speaking multiple languages. This is out of a pilot study in New York where you can imagine an inner city hospital, tons of languages. The typical process was to sort of call the interpreter hotline and say, can I get someone who speaks, Farsi, please, and do your best. This is a technology that's automating that. Multiple languages immediately translated in medical speak, making such a huge impact on the patient experience because there's no longer that wait for that one translator. Maybe they're busy, maybe they don't actually speak the exact language, and we're doing our best. So again, another way that we can connect more powerfully through technology. I'm sure many of you have been looking at many aspects of telehealth. This is a behavioral health model called Able2 that's able to provide the virtual care of mental health, but also tracking and outcomes management. So a whole dashboard, not just the visit, but the whole package for managing mental health. These platforms are getting more and more exciting because it used to just be, well, it's the video visit, but what about everything else? What about my ongoing connection with the patient? And another way, and finally, just to talk about connection, it's important as we come back to people that, again, these are technologies in service of larger human needs. One of our companies that's doing a lot of innovative stuff in digital health really began to tackle this issue of loneliness and looked not just at technology solutions, but human solutions to make a difference, and are putting now the concept of loneliness first and foremost for their Medicare patient population and making that a priority, and then allowing the different tools and technologies that are addressing loneliness to play out by making it a fundamental sort of human campaign first. Okay, number 3, technology to coordinate. Boy, do we need more coordination, and it's really, really tough to do that without data and technology, despite our best intentions. These are the folks who wear the red coats at the Cleveland Clinic, and often, again, it comes down to people. But how do we amplify and extend the work that goes on with people? Humans are trying their best to coordinate. How can we help? How can technology help? This is a company called Honor that is tackling the issue of caregiving. Boy, that is a tough one. So much going on in caregiving, from the family to the patient to the clinicians to everything. Honor is a system where caregivers can actually manage their appointments with the patients through a dashboard, and the families can see the same dashboard. So you can actually even pay the caregiver through it. It's a community of caregivers. As you can see, they can check in with what the person did that day, how was their visit, report back to the family who may not even be in the same city or state. So it's a very robust platform, and we all know that home care is less expensive, and that we're seeing now the majority of caregivers really believe that their loved ones require more care than they can give. So platforms like Honor are helping with that kind of coordination and are having some great outcomes. Coordination around finding the best doctor. This is a company called Grand Rounds, and it's offered to people through their employer. But what it allows people to do is to say, I've got a complex condition, I don't really know where to go next. Grand Rounds is helping identify the most high quality rated physicians, but they're using artificial intelligence algorithms. They're doing it in a very sophisticated way, and then they're matching patients to those providers, and then providing a navigation service through the system, including getting all of your health records organized and over to that person, and then managing you through that process of care. And what Grand Rounds is showing now is that they're saying that if you look at the factors that make a difference in patients' outcomes, they're beginning to have data and gather that data. So top primary care physicians administer preventative exams 50% more often than low. Low-quality cardiologists are administering stress tests more often, unnecessarily, et cetera. And patients reporting a 100% increase in understanding of their medical condition through Grand Rounds of service, raising that from 45% to 90%. So they're arguing that through data, through technology, by better matching patients to the right physicians, they're getting these improved outcomes. So a coordination component there. Coordination might also mean, how does somebody even enter the clinical environment? Can they even physically get there? This is a company out of Boston that's partnering with Lyft simply around transportation issues, which are a significant barrier in certain cities and certain environments for people to actually get to care. And again, it's through a digital dashboard, kind of like an Uber. This is one of my favorite companies to talk about, because when we talk about the social determinants of health, what we find is that it's not that providers and nurses and docs and stuff don't care about the social determinants of health. They don't know where to send people. So if something comes up and you find out that somebody is struggling, with a challenge around mental health or transportation or food or jobs, well, what do you do in that moment, in that short amount of time you have with somebody? Just sort of, I hope things go well, or you send them to sort of social services. And we're finding that that's just not enough. And so platforms like Healthify are making those resources extremely easy to navigate and choose from, almost, if you will, like a prescription, so that it makes it easy for the provider in that encounter to say, okay, I heard that you need help with something that I personally can do for you. Click, here's sort of an example. In our community, we have a connection. We're going to refer you there, and I hope that you can, for example, in this case, community housing was what this patient needed. So Healthify is an example of a platform that is helping coordinate. Cogito, this is around a really tough topic of veteran suicide, and the VA dealing with huge numbers, more numbers than are appropriate there, than are acceptable. And so this is a platform that's helping veterans report how they're doing back to their caregivers through simple questions and self-report, but also the platform tracks their physical activity. And if they haven't reported being active in a few days and they're reporting that they're kind of feeling not great, it triggers a response from the caregiver to then say, you know what, that person might be at risk for suicide. And it's triaging and helping us identify more at-risk patients, and again, then allowing a quick phone call to be done in a very coordinated way. Okay, so next category, technology to diagnose. This has also sort of gone into so many different directions. I find it very exciting. And everything from, these are algorithm-driven questions, like as simple as on a text from a brand new company called Buoy that says, let's go through the symptom that's bothering you. It's not a doctor. It's not replacing a doctor. It's not replacing the work we all do, but it's saying, maybe I can kind of direct you to whether this needs to be an ER visit, or this needs to be a call to your doc, or this needs to be something that you can just send a message about. And a lot of people don't know. A lot of folks don't know how to self-triage when they have a symptom, and then we're left with those long wait times in the waiting room, and at that point, it's almost too late. It would be better maybe if somebody could go check in with this kind of system at home and then be triaged self-triaged to the best line of care. So companies like that. BrightMD is doing it in the exam room, where they've gotten the 20-minute sort of question and answer into the EMR, review of systems, the whole 9 yards, to 2 minutes. And they're calling it the smart exam. I think this is more for follow-up visits, to be fair, than for the first time you see a patient. But sometimes it might be as simple as, how are we doing? Is it better or worse? Do you need a prescription? And being with a follow-up, for example, in this case, ear pain, making that visit virtual, but not just a virtual visit that's a copy of the exact visit, a virtual visit that's a lot shorter. Again, these are algorithm-driven. They're developed by clinicians, and those guidelines are built into the workflow. I bring this example up because it's kind of another funny way to think about diagnosis. It's not an app. It's a pair of socks developed by a young entrepreneur, a young gal, who said, if I can put actually monitors in socks that will tell me if somebody's about to get a foot ulcer before they actually get one, wouldn't that be interesting? And if I could get that data stream into the clinical record while someone's living out in the community, wouldn't that be interesting? So Siren just launched last year, are already kind of gathering their data, but think of the ways in which we can build diagnosis, early diagnosis, into the real world, into the community, have access to it in the care environment, but not wait till something's too late. Another way of diagnosing, I don't know how many of you send people to neuropsych testing. This is a really cumbersome, long, expensive process. And this is a company doing it online now, much more cheaply, much more user-friendly for patients, saving time, saving money, improving that experience in diagnosis. In terms of cervical cancer, that in many rural areas in this country, it's tough to get people that are qualified enough to go do those exams. This is a device that is connected to the internet, to data, that's revolutionizing how cheap and easy it is for just a layperson to almost perform this exam and then send the information to someone who can make a diagnosis. The last category is technology to treat. And when we first started at Health 2.0, this sounded like the futuristic mumbo jumbo. Well, what do you mean technology is going to actually treat patients? And we're beginning to see some of the first examples of this in a really, really compelling way. So, for example, this is a dialysis machine. And the folks behind this company said, you know what, dialysis, the way it's done today, it's not humane. It's not the patient's first choice of an experience. And it's not connected. I don't learn anything about the patient. And so this is the first sort of dialysis machine that's connected, that's designed. I think it actually plays music that you like if you want. That's trying to improve not just the experience of having dialysis, but the data and the connectivity then around that patient's care built in. This is Exendo Wave, which is a headband that allows patients to enter kind of a virtual world when they're suffering from pain. It was founded by a former executive of the AHA and is being piloted in inpatient settings. They are not yet at the stage that they can say they will reduce opioid prescriptions, but they're finding dramatically improved pain scores from this sort of virtual reality program. And I think soon we'll have the validated studies to show that it's resulting in an alternative to certain types of pain medicine prescriptions, but really brilliant technology here with sort of, again, treating the actual pain with Tableau is, actually being dialysis itself. Pair therapeutics, we just, had these guys present in January. This is the first, now they claim this, so we'll have to look this up and follow the story. They claim they're the first digital therapeutic approved by the FDA for the treatment of pain. So what they're showing is that in folks who are in recovery for opioids, that with their program, which is a combination of learning, so it's online learning and modules customized to the patient, and coaching, so there's a digital component and a human component, that people, it's a significant difference of opioid abstinence compared to just face-to-face therapy, and it reduces the amount of time of face-to-face visits. So their data has been extremely powerful. It has gotten the FDA's attention as an actual therapeutic alternative to other approaches. So fascinating here. Omada is a platform in diabetes that combines a lot of the technologies we're seeing for diabetes monitoring and management together with data, together with human coaches, and they are beginning to publish outcomes slowly but surely, that within 12 months, the average person on this digital health platform lowered their 5-year risk for type 2 diabetes by 30%, stroke by 16%, heart disease by 13%. So again, the message here is it's not technology replacing humans, it's technology extending what we're doing in care in many, many different dimensions. And with studies and with the evidence base building up, what are the ways in which these can augment and improve? This is a company out of San Francisco that I think 2 weeks ago announced this. And I have to be honest with you, so my father has type 2 diabetes. So I emailed them, I said, are you saying that you can reduce the amount of time someone is on insulin, actually eliminate and reverse type 2 diabetes? And I've got to see it to believe it. But the first data are out for about 150 patients where the reduction in insulin-dependent diabetes is the biggest numbers I've ever seen. So I encourage you to take your own look at Virta. And again, a digital health platform, extremely focused nutrition planning, not just sort of off the checklist, but extremely focused. They're looking at ketogenic models, and I'm not in that field clinically myself, but very, very specific, tight management of the diabetic with a physician, with a care team, but with this highly managed process using data, using technology. So I'm thinking of getting my father involved, at least to research it, but we'll see. And this is a company for type 1 diabetes, started by a dad of a type 1 diabetic child who said, you know what, too cumbersome, too painful, too scary, that if I inject the wrong amount of insulin, I could kill my own child. That's not okay. So they built an artificial pancreas, which basically means an implantable sensor, a mechanism to dispense insulin, but then, so if you're measuring the blood glucose, you have a dashboard that you can see on your phone as to what it is, and then it dispenses insulin in response. So it's a complete closed loop of a system, device, diagnostic, data, software, all connected, Bigfoot Biomedical. They're on their way after having raised about $120 million, started by parents saying, we don't like the current system. Okay, so that was a whirlwind tour of all the ways that technology, just some examples of how technology can make a difference in the patient experience. But what is the impact this is all having? And I think it's so important that we learn to measure and think about ways that we're measuring the impact of all of this innovation. It's exciting, but how do we then, what are the metrics and how do we do this? So it's early days, but I'll just share a little bit of data. One is that we are now looking at disease-specific applications by therapy area. And this is a small segment of the overall number of digital health applications I talked about, which are disease-specific. But it is interesting to at least begin to quantify and see that there are now these technologies. Interestingly enough, and I think it's good that many of them are in the mental health and behavioral health area, but heart and circulatory, diabetes, nervous system, and others, we're seeing an interesting spread here. And this will probably evolve over time. So just sort of measuring where are these companies working and in what areas. The number of studies has grown over time. So like I said, we started in 2007. There was almost no validation for this stuff. Does it work? How does it work? We are now close to 140 studies year to date across the industry, and a number that are randomized controlled trials, so not bad. And I think, I reported some data on some companies that I could find for you, but we're going to, in the next few years, I think, see some of these early stage companies report their actual results. So we'll be keeping an eye on this. And initial estimates now are showing that just in 5 areas, so diabetes prevention, diabetes, asthma, pulmonary, and cardiac rehab, that just using 5 curated apps that are high quality can result in the reduction of acute care to the tune of $7 billion. So this is just a sense of where we might be going also here, not just in patient experience, but in the cost reduction as well, and the quality outcomes. So I hope that's just an overview. But again, I think it's important to echo what everybody else has been saying, that technology is not about a replacement. It's not about a problem fixer in and of itself, but it is a contributor and can be a vital contributor to patient experience improvement by way of informing, connecting, coordinating, diagnosing, and treatment. And also that it's important to know that care is not just what happens within the walls of the clinical environment. We have to be thinking about all stages and in all environments. And I know we can't clone ourselves to be in all stages and all environments of a person's care, but that's where hopefully the right technologies, built around the human experience, built with human design, can help us do that. So thank you so much.